Hello everyone, my name is Barrett Hardiman. I am the lobbyist for VDHA. Today is January 16th and I am here to give you an update on the first week of the General Assembly session. Session started on January 14th with 21 new delegates taking their seats in the House, and that is an increase in the Democratic majority by 13 seats. So it's a significant change in the makeup of the House of Delegates. We've also seen a number of legislators who've been tapped by the new Spanberger administration to be part of that administration. So there are still some special elections that are happening. So we will have some new legislators and some that are transitioning from the House to the Senate in the next couple of months. Some priority legislation for the Dental Hygienists Association are two bills that were introduced by the Dental Association in an effort to address the gap in the workforce for dental hygienists. Unfortunately, we were not consulted on these bills before they were drafted and put in. We are working with the patrons of the bills and the Dental Association to make some changes on a couple of them. The first bill is the Preventive Dental Assistance Bill, which a lot of you all have probably heard about, maybe heard it called the Scaling Assistant Bill. But this bill essentially allows dental assistants to perform a lot of the tasks that you all have in your scope of practice. The bill numbers for those are SB 178 and HB 970. We are actively and aggressively opposing this bill. There is nothing good about this bill. We've actually talked to a number of legislators who their own dentists, and some of you have talked to them about how bad this bill is. I think there's a good understanding that without the proper training and education, dental assistants should not be performing the tasks that are in your scope of practice. So we are working very diligently to get this bill killed. The other bill that the Dental Association has introduced has to do with internationally trained dentists and providing a path to licensure for them. This one's a little more reasonable. We're still concerned about it. It doesn't really state how we're going to evaluate the international training programs for dentists to ensure that they've had the correct training to become dental hygienists, because as we all know, preventive care is very different from restorative care. So we are working with the patrons of those two bills to find a compromise so that we can ensure that the Dental Hygienists Association is involved with the Board of Dentistry in determining what standards are for education for internationally trained dentists, for them to become dental hygienists, become licensed dental hygienists in Virginia. The bill numbers for those are Senate Bill 282 and House Bill 1036. In their current form, we're still opposed to them, but we are hopeful that we can get some changes put in place that will make them more palatable. Ultimately, our goal is the same. We recognize there's a gap in the workforce. We are trying to solve that problem. The quickest way to solve that problem would be to get the 800 licensed dental hygienists who are not in the workforce back in the workforce, and to grow the education programs in the community colleges and universities to graduate more dental hygienists. Because the most important thing in our industry is the patients. We want to make sure that they're safe and that you all are respected for the professionals that you are. So I am excited to be working with you. This is my first session with you. It has been a lot of fun working with the leadership of your organization. And I am going to be down there every day, making sure that your voices are heard. And I am hopeful that you will join us on the 23rd for our lobby day. It's going to be a great day, and we're going to make a lot of impact with our legislators. Thanks so much for your time, and I look forward to chatting with you next week.